Hi everyone, my name's Steph and it's good to be back with you. Um, Today I want to talk about singing, maintenance and care, and basically what I want to say is the voice is an instrument, and we need to do things to take care of our instrument because the voice is just like it is a musical instrument, only difference being that it's joined to the human body. So the first thing to say is to avoid fatigue when looking after the voice, because when you're tired, your whole body's tired, and your vocal cords get tired. And if you haven't been sleeping well, or if you've just been working too hard, or whatever reason you're not sleeping, you need to take time off from singing and give yourself time to rest and recuperate. Because when you're tired, like singing will put stress on the vocal cords, and if you sing with overstressed vocal cords, you run the risk of permanently damaging them. So, basically, vocal cords can get blisters, and they're called nodes, and they come from constant friction and use, and they're little swollen spots that they can go away with rest, but without rests, the nodes will grow, and then they'll require surgery to remove, and you don't want that. That's the last thing you want. And then the next thing is avoid singing when you're sick, particularly if you have a sore throat, because illness is your body's way of saying, stop, I don't want to do anything, I need to rest. It's basically saying I've had enough. And most of us don't feel like talking when we're sick. We don't want to talk, much less sing. But people can mask the symptoms too. They can take medication or throat lozenges or whatever, but really you need to get well. And the sore throat's the worst one because the vocal cords are inflamed and swollen already, and they're very sensitive, and the last thing you should do is apply more stress through singing. So you need to rest and drink lots of water and take vitamin C. And if you need to see your doctor, then see your doctor. Same thing for colds or flu or sinus congestion. Apparently singing with a cold wears out your voice for the short term, and it might not damage your vocal cords. It'll just block your nose up, but you just don't want to sing with a nasal sound. It's kind of, I don't know, bad enough singing with a nasal Australian accent or any other accent that's nasal, let alone singing with a nose that's blocked up and a nasal accent. So we don't want that. And then the next thing is diet, eating right. Of course, a well-balanced diet will help you avoid illness, and if you're eating a lot of crap food, your body will just get sick. It'll just sicken. You're denying it nutrients and proteins, you're denying it real food, and you're going to fall sick. And so the illnesses, of course, we've mentioned what they do to your singing. And the other thing is apparently dairy, yogurt, milk, all that sort of stuff. It just gives you mucus, and this is a bad area for me. I tend to eat those things. I eat a lot of yogurt and dairy, and although I put fruit and good things in there with them, they do cause mucus. So that's we don't want that. And the other thing is to drink lots of water. Drink loads of water. We can't stress hydration enough. We need it, and I need it, and it just helps with everything. It just helps everything flow smoothly, around the body. And then next thing is stay away from drugs, alcohol, tobacco. And smoking pot or tobacco, it burns your vocal cords, and the smoke you're putting in your lungs will limit your breathing ability, and you need your breathing to support your vocal. And then just any drug, it'll just make your body sick, and nobody knows what the other drugs do to your body, and we don't know really fully what they do to your body, let alone your voice. Next thing is screaming. We don't want to scream because we're not trained. We don't want to scream when we're not trained, and the people that are paid to scream have been to see a vocal coach to affect that sort of style. So basically that's what we need to do, get properly trained, and then maybe scream, but do it in a controlled way. So then basically the next thing is avoid caffeine, because it dries out your vocal cords, it dries your voice out. So drink water, avoid alcohol, same as caffeine, dries everything out and you get a hangover. And cough drops, apparently they keep the throat moist, but too many can cause mouth ulcers and other irritations, and I didn't know that, but there you go, learn something new. No talking, that's hard for some of us to do. I like to talk, and I don't like to talk too much, but I don't like to talk too little. I think I'm somewhere in the middle. And then the next one is meditation. I find meditation really good for just freeing me up. I feel like I'm on solid ground if I meditate regularly. And that being on solid ground just causes the body to feel relaxed, and it causes me to just feel like I'm breathing in all the right places. And then, avoid long phone calls. That's another one. My brother and I talk for hours. We just crack each other up, saying stupid things, and sharing stupid memories. Sometimes I'll do a long phone call with my brother, but again, it's just talking a lot. It does put stress on the vocal cords. And then the final thing is, if you exercise, then it's just a case of you keeping your body healthy, and therefore your mind and your vocal cords stand a chance. We're causing those to be at their best. And I like to do yoga. I did cardio tennis as well, but the yoga, I need to do a lot more of it. Anyway, so that's it pretty much. That's just a video on vocal health. So I hope to see you again, and happy singing. Bye bye.